A global health emergency. The World Health Organization raises the alarm over a new Ebola outbreak. The virus has killed nearly 90 people in the Democratic Republic of the Congo and Uganda so far. Will it spread further? This is Inside Story. Hello, I'm James Bays. A global health crisis, not a pandemic, but the World Health Organization is warning the Ebola outbreak in the Democratic Republic of the Congo and neighbouring Uganda could be much larger than what's been detected so far. The global health body is advising the countries to activate national disaster mechanisms and introduce cross-border and internal screening. How would declaring the Ebola epidemic a public health emergency of international concern help stop the spread of the virus in areas facing serious security challenges? Would it help raise funds as the World Health Organization and health NGOs are facing a severe cash crunch? We'll raise those questions, among others, with our panel of guests in a bit. But first, this report by Imogen Kimber.
A new outbreak of the Ebola virus in the Eastern Democratic Republic of the Congo. The World Health Organization has declared it a global health emergency, but not a pandemic. This outbreak began when the body of someone who died of Ebola was taken from the town of Bunia to Mongwalu. That's a mining town with a large population. Ebola is contracted through contact with bodily fluids of infected people or animals. The DRC has faced many outbreaks of Ebola, mainly of the Zaire strain. But this outbreak is caused by the Bundibugyo strain, which has no vaccine or specific treatment. And officials say it can also have a fatality rate of up to 50%. But they say they can manage the situation.
The epidemic will not get out of control because there are no vaccines, because there are no medicines. No, this is not an epidemic we are discovering for the first time. We do, in fact, know how to keep the epidemic under control.
Although he says that may be difficult, as the centre of the outbreak is Ituri province in the east, where fighting between rival armed groups have killed and displaced scores of people in recent weeks.
It's an insecure area. What do we do? It's a major challenge, especially because of the Mombasa Road, where there are a lot of armed groups. That's why it makes monitoring and managing this outbreak more difficult.
Ituri borders South Sudan and Uganda, which has already reported cases. The World Health Organization is sending support.
We have deployed medical supplies and protective equipment for infection prevention and control to Bunia, the Ituri provincial capital. Today, I have released $500,000 from WHO's contingency fund for emergencies to immediately support the response.
Health authorities across the region are calling for cooperation to stop the spread and avoid a repeat of previous Ebola virus outbreaks that have killed thousands of people. Imogen Kimber, Al Jazeera for Inside Story.
All very worrying, one of the world's most deadly diseases, and that's why we want to bring you the facts, and that's why we've got this panel with us today. From Kinshasa, Ariel Kestens. He is head of the Kinshasa Delegation in the Democratic Republic of Congo at the IFRC, which is the International Federation of Red Cross and Red Crescent Societies. In Phalange in France, Dr. Margaret Harris. She's lecturer at the United Nations Institute for Training and Research and former spokesperson at the World Health Organization. And in Nairobi, Dr. Ahmed Ogwell Ouma. He is CEO and president of Village Reach and the former Deputy Director General of the Africa Centres for Disease Control and Prevention. Thank you, all three of you, for joining us today on Inside Story. Dr. Margaret Harris, we had you on this programme just over a week ago talking about the hantavirus on a cruise ship. Now, at the time, yourself and the rest of the panel said, yes, a serious subject, but it was well under control. And as a stress test of the global health system, the global health system had passed. Do you have the same verdict right now with the Ebola situation?
Well, Ebola is always a really, really serious concern wherever it happens, but particularly if it happens under this perfect storm of conditions where you've got one of the less well-known strains, Bonivogia, which has only caused 2 other outbreaks, and we haven't got a vaccine candidate for it, and we don't have a specific treatment for it, coupled with happening where there is a really complex, difficult, ongoing conflict. I've worked in that area in 2018-19, and it's really hard to get around. It's always unsafe. Some of my colleagues were even killed. It's a difficult response, and we've also got large numbers of cases already, so it's been burning for a while. And having said that, at least action is being taken the minute the world learned about it.
So, Ariel, you are there in the DRC. Your particular job covers DRC, Rwanda and Burundi. And obviously there's concern about regional spread here. Tell us, and we'll go into the details in a minute, but how concerned are you?
We are concerned, of course. At the beginning of every outbreak, we must be concerned until we can see some of our measures starting to have some impact in the containment of the outbreak. At this time, it is concerning the period that has passed from the first moment, from the first, let's say, suspected case until the pandemic has been declared in both countries, in Uganda and in DR Congo. And that period was crucial to start the containment of the outbreak. At this stage, we are now reacting to it. We are putting in place some of the measures that are typical measures for this type of outbreak, with the extra layer of complexity that there is no vaccine. And remember that one of the mechanisms that we use to contain epidemics or outbreak, like in this case, is ring vaccination. Without ring vaccination, most of our measures are going to be at community level. And of course, at this time, this is concerning.
Just, Ariel, explain to us what you mean by ring vaccination.
Well, it's a measure that the public authorities would normally take to contain an outbreak, an epidemic, that it's about vaccinating individuals all around the affected areas, and of course, all around those who has been in contact with the virus. So in that way, creating a ring of safety, let's say, around individual suspected of cases or affected with the virus and the communities and population, a barrier that is difficult to cross through, let's say, by people with the virus or suspected to have the virus.
Ahmed, let me ask you to go back to basics, if you can. And I suppose my question is, what is Ebola? It's a very, very scary word. It comes, I believe, from fruit bats originally. But explain to us how it's spread, how contagious it is, how deadly it is, and what does it do to the human body?
Thanks for having me. And first, let's really reach out in our thoughts and prayers to those who have lost their lives and are affected by this current outbreak of Ebola. So Ebola is a virus that really resides in bats, especially fruit bats found in that belt across the central parts of Africa. And human interaction with the bats result in the virus jumping into the human population. Now, the virus has over time become very adept at not just within the bat, the fruit bat population, but when it gets into the human population, it becomes easy to not easy, but it becomes possible to transmit it between one person and the other. Transmission is by close contact of body fluids and anything that body fluids has touched, clothing and things like that. And some of the early signs are fever, and we have so many diseases that present as fever. Some of the early signs are, the result of bleeding from within the orifices of a human being. And this is one of the unique ways of knowing that you do have a challenging situation. So it's important that we have our health workers to have a high index of suspicion. It's important that communities understand how Ebola looks like, and it is important that reporting is fast and efficient so that we don't have the spread of the virus as has happened with this outbreak. Ebola can be stopped, and we have done it before. We just need to learn the right lessons so that we can stop it again.
Dr. Ahmed, that was a useful medical profile. Perhaps I should add a little bit of history of Ebola, because it first was identified in the country that's now called the Democratic Republic of Congo. Then it was Zaire back in 1976. It was discovered more than 1,000 kilometres away from this current outbreak in the village of Yambuku. But it was named after a local river to avoid stigmatising the village. The river was called Ebola. The DRC has suffered the most with Ebola. This is the 17th outbreak. Between 2018 and 2020, the virus killed nearly 2,300 people. But in 2014, the largest Ebola outbreak began to spread across West Africa, but mainly in Guinea, Liberia and Sierra Leone. Over 2 years, more than 11,300 people died. Ariel, that is the historical background. And what is interesting is it started in Zaire, DRC, and then in West Africa, post-conflict societies there, now in what is very much a conflict zone, the centre of this in Ituri. How much more complicated does that make the treatment now and the work that has to be done by people like yourself?
Well, it's important to understand why conflict is add a layer of complexity to contain the outbreak. One of the reasons why it adds a complex layer of complexity is because of the displacement of a group of people due to the conflict, right? But that's not the only driver for the mobilization of people and migrants. There is also in that area, it's a commercial corridor between the rest of DR Congo and surrounding countries, and people normally move from one side to the other of the country or the different district in Congo. As well, and we should also remember this, that in the epicenter of the pandemic, they are mines, and they are temporary workers that come and go to those mines. So conflict adds a layer of complexity because of the displacement of the population that it drives, but it's not the only driver. In addition to that, conflict in particular add the constraint of mobility of health workers and volunteers of institutions like the Red Cross. That has at the center the duty of care of its own personnel, and therefore take the precautions to make sure that whenever a volunteer or a health worker is reaching to a community or is mobilizing from point A to point B, the measures are taken to protect him or her. In a conflict situation, those measures are, of course, higher to be able to manage different type of risk, and that at the end of the day tend to constrain the response. So those are two very specific elements of why in a conflict area, the response is a bit more complex.
Margaret, I mean, if you look at what's going on in terms of the conflict, there is an ISIL affiliate there, the ADF. There's something called Codeco, which is another armed group. There's the CRP, which is a group that Convention for the Popular Revolution, remarkably led by someone called Thomas Lubanga, who was jailed by the International Criminal Court back in 2012 and released in 2020, and is now leading a group that includes child soldiers yet again. The Congolese army are there. In the wider dispute, you have M23, all of these groups. If you were still in your job at the World Health Organization, sending extra medical staff, extra aid workers into this area, I mean, you wouldn't want to risk their lives, would you?
Well, I've risked my own life. I've in fact been caught in the crossfire between M23 and the Congolese National Army. In fact, quite often, WHO staff have been the only people that can go. Quite often, partners can't go into those areas because they've got restrictions on the level of security. Some international NGOs won't allow people with arms to accompany them. We've often had to evacuate treatment centres and put in our own people in order to keep things going. I know I once arrived at a treatment centre that had been trashed and destroyed with another colleague to see if we could continue doing it, just us two. So this is how it works. And again, that's why you do need organizations like the IFRC and the World Health Organization to ensure that the people who need the help most can still get it.
Ahmed, I mean, if we look at a report which was by Médecins Sans Frontières, which came out just before it was discovered that there was the Ebola in this area, that was the 30th of April this report was released. They talked about a health system before any of this in complete collapse. And you've got Ebola now, but already a real problem with cholera and mpox and care for sexual violence victims almost non-existent. This is a real problem because there's none of the basic support services there that would be there anywhere else in the world, are there?
And this is the huge challenge when you find an outbreak of this magnitude and of this type of virus occurring in an area where the basic health system is not functioning at capacity. It means that you have to rely on the community itself to be able to give the push for information, to give the push for containment, and to give us information to be able to act with some level of accuracy. The absence and the collapse of the health system does not mean there are no people who need support. In fact, that absence tells us that our action is required today much more urgently than if the health system was in place. And the community becomes the backbone of that. We need to find effective ways of empowering the community to be able to understand what this outbreak is about, what their role is, how we can be able to get good information out. And we need to ensure that as we do that with the community, we are building some levels of trust amongst all the players that could possibly disrupt the interventions that we need to make. And that means you need to speak with every party that is in control of the area. It means that you need to engage with the communities in a way that they understand and therefore can be able to trust the information and the interventions that come into play. I must add that for all types of outbreaks, the battle is won before the outbreak occurs. The preparedness that we make, the systems that we put in place, the capacity that we have in reserve, that is what makes an outbreak be controlled quickly. In the absence of that, the work is more, but with the community in place, we can still be able to control so long as we build good trust with the communities that are affected.
Margaret, as you discussed, there was an outbreak in the same area, 2018 to 2020. What's concerning is that was picked up earlier. According to research by Imperial College London, they think this has been transmitting since late April. So there's several weeks when no one knew that the Ebola was there. That lag, how concerning is that to you about the possible scale?
Oh, very, very concerning. And this is exactly, I'm very pleased to see that the World Health Organization Director General immediately declared the public health emergency of international concern. And he did that that was one of the reasons. The extent of it, it's an unusual event because it's not one of the viruses, the strains that we normally see. But also it's spread, as you mentioned, to Kinshasa, to Kampala, and the complexity of it, but the scale of it as well.
Margaret, sorry, to use that official term, public health emergency of international concern, my understanding that's only the 10th time in the WHO's history that has ever been declared.
Yes, and this is way the fastest. Especially for an Ebola outbreak, the big West African Ebola outbreak you mentioned, that wasn't declared for 8 months. The other outbreak in the same area in the North Kivu, that wasn't declared for another year because it didn't, it was under a year, it was about 10 months, because it hadn't spread across international borders. And when it did, it was declared. So this is way the fastest declaration, and it's not something that the Director General does lightly. And this tells us that all stops are being pulled out to get this under control as quickly as possible, including getting that money, that funding. You mentioned the Central Emergency Fund. That was actually set up as a result of the West African Ebola outbreak because it was very difficult to get the money to do the work. And that was provided so that the work can happen as quickly as possible.
Ariel, if we look, that is obviously concerning, the fact it took so long to detect it. But also the other thing I would have thought is a significant concern is the spread that's already taken place, because we have two cases which apparently don't have a link to each other, two people who'd travelled from DRC, confirmed cases in Kampala, the capital of Uganda, a suspected case in Goma, the regional capital, and it seems a case in Kinshasa, where you are. Now, Kinshasa, from where the main outbreak is, I'm told, a distance of about 1,600 kilometres. You move it to another continent, that's about the distance from London to Athens.
That's right. And that you are measuring the distance in kilometers, but in fact, in time of traveling, it might take maybe 48 hours or 72 hours to reach Bunia, the capital of the province of Ituri, from Kinshasa and vice versa. So that means that we are facing a challenging outbreak at this stage. And I would like to emphasize what Dr. Ahmed has mentioned already twice in his intervention. He is placing communities at the center of the response, at the center of the containment of this outbreak. And I would like to expand a little bit on why that is key. Well, first, it's key, as we discussed, because in this case, there is no vaccine for this particular strain of the virus. So most of the measures that are going to be in place will have to rely in the community, in individuals doing the right thing. Now, for an individual to do the right thing in terms of taking the measures to take care of himself and take care of his family and take care of those who are surrounding him or her, he needs to receive trusted communication, communication in terms of measure that he or she can act. And that trusted communication normally comes from people that they trust, that they are their colleagues, other volunteers in the same community, the health worker that has been in the community for already a while. And it has less to do with international teams coming to reinforce that layer of the system. It's also important that rumors, for example, at community level are being managed and stopped, right? Because rumor also may cause more damage than actually a situation in which people don't know what to do. None of them is an ideal situation, but certainly stopping rumors is another aspect of this response that comes at community level, that comes together with trusted communicators or trusted volunteers at community level that can deliver those messages in both ways, to stop rumors and to communicate the measures that need to be used to prevent the spread of the virus, which, by the way, must be evidence-based measures.
Ahmed, it is already in Kinshasa, a city of 18.5 million people, where Ariel is. We believe it's in Goma, a city of about 1 million people, and in Kampala, a city of 1.8 million people, not all that far from where you are in Nairobi. Is an expansion of this almost inevitable? Is that your fear?
A concern, not a fear at this time, for three reasons. One is the cases reported in Kinshasa, Goma, Kampala were all imported. And by all indications, local spread has not been documented. And that points to a health system that actually addressed the concerns of those individuals in a way that protected the health worker and the population. We await to see if anything else will come out of it. I am concerned at this time around the possibility of that. But second is the level of distance that they had to travel to reach these three relatively large cities without them being detected. This points to an indication that we need to tighten our surveillance systems because illness is seen over days. It's not something that happens very quickly. And third is the fact that we have several countries in the same area. South Sudan and Rwanda will be added to DRC and Uganda. So the possibility of a regional effect is already in place. And that's why our intervention right now should also quickly move to be regional in nature. All the countries that are surrounding the DRC and there is access for movement of people need to heighten their surveillance and get ready. We cannot be able to build a ship when we are in the water, but we certainly can be able to improve the nature of the ship if we know where the problems are. And that's why the regional approach is absolutely essential at this stage. I would encourage the governments of Uganda, of Rwanda, of South Sudan, indeed, any other country that has movement of people in connection with that part of the DRC to immediately put in place active surveillance and be prepared with the necessary countermeasures, including training of health workers, so that anything happening is contained quickly and effectively at source.
Margaret, very quickly, the World Health Organization on its maximum alert. Anything else you think needs to happen now, urgently?
I think, again, what everybody else has said, really support the local health system as best you can. Honestly, if I had Ebola, I'd like to be treated by a Congolese doctor because they know Ebola better than anybody else. But they need all the support they can get and things like getting the tests out to the periphery where they can do them and help with the communication and any kind of support they request. We, the world, should be providing.
Dr. Margaret Harris, thank you, and also to Dr. Ahmed, Ogwell, Ouma and Ariel Kestens. Al Jazeera's teams are on the ground in DRC and in Uganda, and for further explanation and analysis, head to our website, aljazeera.com. We'd love to hear what you think. Go to our Facebook page, that's facebook.com/AJ Inside Story, or look for us on X. There we are at AJ Inside Story for now. That's it from me, James Bays, and all the team here. Stand by though, because Al Jazeera's coverage continues, the very latest, in just a moment.